Good afternoon. Happy belated Father's Day to everybody. I hope everyone got to spend some time with their families yesterday. I know I went kayaking with my family, spent some time at the beach, and got to see much of the beauty that is our city. So again, I hope everybody got to enjoy some family time yesterday. Thank you for joining me for this COVID-19 update. Joining me on the call today for questions, Under Sheriff Pat Ivey, Fire Chief Keith Powers, Emergency Operations Center Director Steve Woodard. As of this morning, the Florida Department of Health is reporting a cumulative total of 3,085 COVID-19 cases in Duval County, 60 deaths, 318 hospitalizations. Over the course of this pandemic, our local media has by and large covered the facts and been balanced in their reporting, despite much of the sensationalism we've experienced in the national media. In the last week, though, however, there have been some stories reporting about the increase in cases and hospital capacity without full context. That misleads the public, who turn to media, local media, for information, and where that has happened, it's irresponsible. An example is there was a headline about a hospital being at full ICU capacity over the last week. I can't tell you the number of citizens that saw that headline and stopped me in public and said, "Hey, Lenny, what's going on? COVID cases are up and our hospitals are full with COVID patients," which couldn't be further from the truth. So I would just ask that as the facts are reported, which is that our numbers are up, that the context and the facts behind that, which includes hospitalizations, which is one of the most important numbers, are also reported. Cases are up for a variety of reasons. One is because access to testing has increased significantly. When we started testing at Lot J, there were age restrictions and folks had to have symptoms to be tested. Now those restrictions have been lifted. In the last week, we've tested 700 to 800 people per day at Lot J. That's double the number throughout most of this pandemic. Let me also say a point about another number that's being reported in certain media, and that is the percent of positives of people tested per day. You cannot calculate that number accurately, because if 800 people are tested in one day, those 800 test results won't be released necessarily the next day, and those 800 test results won't all be released by the health department on the same day. So it is simply an inaccurate number to report percentage of daily positives. The math just doesn't work. What we can tell you is that, yes, the numbers are going up, but hospital patients related to COVID-19 are not increasing. Many businesses are also now requiring negative COVID-19 test results to allow employees to come to work. And there are some that are clearly not taking this virus seriously, so experiencing a surge in numbers at testing facilities. Without precautions, to be clear, the spread is real, which is what we said when we reopened. It spreads person to person. For example, there have been people in crowded bars and walking on crowded streets who are not wearing masks and who are ignoring social distancing. While the number of cases are up, the fact is hospital admissions related to COVID are not rising. As of this morning, there are only 14 COVID-19 patients in the Duval County intensive care units. That's throughout our entire city. Also, our intensive care units are at 68% capacity, which is lower than before the pandemic began. My team and I personally get this information verbally via phone calls with local hospital leadership. Due to HIPAA rules and proprietary information, we are unable to publish individual data. Media can contact our local hospitals to independently verify this information. Any local or national media headline leading people to believe that masses of people are getting sick and hospitalized from COVID-19 in Jacksonville is not true, and it's irresponsible. Reporting rising cases is fair and accurate. Suggesting people are sick in ICU is not. The hospitals do, however, have contingency plans to expand beds if in the event that would become necessary. Additionally, in addition to hospital numbers being low, we're also seeing low numbers of COVID-related transports by Jacksonville Fire and Rescue. We're also not seeing an increase in the mortality of this disease locally. The way back from this is with personal responsibility, and that includes wearing masks and face coverings. Wearing a mask is not a political statement. It's about protecting yourself and your loved ones and your neighbors. It's about slowing the spread from asymptomatic carriers to vulnerable populations. I wear my mask when I'm in a grocery store, gas station, or other place where I can't be socially distant. And I encourage everyone else to do the responsible thing and do the same. Yesterday, Governor DeSantis said the Department of Business and Professional Regulation will be enforcing occupancy and other requirements as part of the state's phased reopening. My team and I have heard from citizens asking me to make masks mandatory. I do not think that's a prudent action to take. We do not need to have law enforcement out in public enforcing this. It's not an efficient use of resources, and we're not going to start prosecuting people, ticketing people, and arresting people because they choose not to wear a mask. I reiterate, however, if you're watching this, and tell this to your friends, please wear a mask when you can't be socially distant. It's out of respect and care for the vulnerable around us that could end up with COVID-19. I'm asking businesses and individuals to do the right thing here and take care of each other. If you're an individual, behave responsibly, wear masks in public and in places where you can't be socially distant. If you own or operate a business, consider making masks mandatory for the safety of your employees and customers. It's in everyone's best interest to do this. As I said last week, we cannot afford to be complacent. This virus is with us, and we all play a part in protecting ourselves, our family, and our neighbors. While it's unfeasible to quarantine indefinitely, we must not be reckless in how we reopen our city and our economy. We must reopen safely and responsibly, and that's what we're doing in Jacksonville. Young people, while you may not be at as high of a risk to contract severe symptoms from this disease, it can happen. And even if you're asymptomatic, you can spread this to someone who may be at higher risk, someone that's close to you, someone that you care about, if you don't take precautions. We need everyone, every single one of us, to take personal responsibility, make wise choices as we continue to fight this virus, wear masks in public spaces, frequently wash and sanitize your hands, continue to practice social distancing where possible. The key to protecting our friends, neighbors, and loved ones is to behave safely and responsibly. Before we go to questions, I'm going to give some other folks on the call a moment to provide some remarks and updates. I'll start with Under Sheriff Ivy.
Good morning, Mayor.
Morning.
So an update, I want to mention to the group, on June 19th, we had our first confirmed inmate positive COVID test result. I think that speaks that the protocols that we had in place going through the pandemic were working quite well. That was the very first. But knowing that how these things and the dynamics change rather quickly, since June 19th, we have had now 20 inmates that have tested positive. It has affected a few of our employees and a couple contract employees with our health services provider in the jail. We have worked with FDOH in reference to we are now going to implement testing of 100% of the inmates in all 3 of our facilities. And to give an idea what that looks like, today's daily count for inmates is 2,706. We have already tested probably just over 100. The Department of Health testing will be implemented. That's our internal testing. Department of Health testing will start tomorrow, and we are working through that. And what that means, visitation, we've got several questions in reference to visitation. I think those questions are coming from people that aren't paying attention. We've been doing video visitation since March. So there has been no in-person visitation. I think maybe people are just playing catch up with what we've actually been doing. So we've got protocols in place. All new arrestees or inmates coming into the facilities will all be tested. And we are taking appropriate quarantine protocols. So we sent out a message to the media yesterday and an internal message stating such, and that's all I have. I should note that we've only got about 1% of our employees that are either in a positive test or a self-quarantine or a quarantine mode in response to COVID, and that's effective at this moment now. Thank you, Mayor.
Thank you. Fire Chief Powers.
Good morning. Thank you, Mr. Mayor. Just a quick update on where we're at within the Jacksonville Fire and Rescue Department. Currently, we have 3 uniformed firefighters that have tested positive for COVID-19. We also have 1 JFRD lifeguard that has tested positive as well. That's resulted in 66 JFRD uniformed personnel and 13 lifeguards being in quarantine right now. Obviously, we have to continue to be vigilant in making sure our employees are protecting themselves and protecting the people that we respond to. But it's just, we're not at our all-time high like we were back in April, so we're still lower than we were then.
Thanks, Chief. We'll move to questions. Kelly, news for Jax.
Thank you, Mayor. My question is for the undersheriff. Just point of clarification and then a question. You just said that this was a contract employee with the Health Services Division of the jail. Was this a doctor? Could you kind of clarify what that person's role is? And then my next question would just be, you're now testing everyone at your 3 facilities, but how many people do you estimate might have come in contact with this first person?
That was for
The undersheriff.
undersheriff. Yep.
I mean,
Oh, here it is. Go.
okay, so in reference to your questions, the exact title, he is a medical provider. So he would have been an individual that would have been in a doctor role, a doctor type role. I'll get his exact title for you through our PIOs. How many people were working with the Department of Health in reference to the contract or contact tracing? That's how we got to the point of we went from 2 confirmed inmates on or like Friday, and by Saturday evening we were at the number of 20 with confirmed positive cases, and that was directed because of testing of people that we knew we needed to test. So what that total number looks like moving forward, we'll have a better indication of that when we finish the tracing of the contacts.
Eliza with First Coast News.
Thank you, Mayor. So as you said, hospital admissions related to COVID aren't rising, and reporting so is irresponsible. So that said, I've got a 3-part question for you. 1, where are you getting this data, and do you have charts or graphs that you can show this publicly? 2, what are those numbers? And 3, how can the public and the media continue to get that updated information, since it is very important?
Sure. So thanks for that question. Our Emergency Operations Center, they are in contact daily with local hospitals. I also speak to via phone. I call the leadership of those hospitals sometimes every day, sometimes every other day. I think we've been in contact every day now since Friday through today. And I've been doing that through this entire pandemic, by the way. So at this moment, the last data point I have, 19 patients and intensive care units throughout the entire city of Jacksonville. 14 COVID-19 patients across the entire city of Jacksonville in ICU across all hospitals. In terms of individual information for individual hospitals, you'd have to reach out to the hospital's PIOs. They're there to obviously answer those questions and get you the information you need. Bridget with Action News.
Hi, good morning. My questions are for Chief Powers and the undersheriff. For Mr. Powers, is there anything being done to, or are you asking your employees to wear masks? Is that something that is being done for employees? Is that a requirement? Same question for the undersheriff. Will JSO employees be required to wear masks, especially when they're out in public interacting with citizens? And then as far as quarantine goes in the jail, what happens if you run out of space? How many cells are you designating for quarantine?
Bridget, so early on in this pandemic, we started putting out policies to our people on the requirement of wearing masks. So when we respond to a emergency scene, our policies now say that we take one person, we put them in a mask, we go inside, we put the patient on a mask, and we let that one person do the evaluation. And then if we can, we get that patient outside into an open air environment. That's to protect, the mask is to protect not only the patient we're responding to, but to protect our employees. As far as when our personnel are out in public, say going to the grocery store or whatever, we require that the person going in, only one person go inside the grocery store, and that that person wear a mask and of course follow the one way signs that are in there. And that again is to protect our employees and to have as few people as we can out in the public getting exposed to potential COVID patients.
So do you have me?
Yeah, you're up.
Okay, so in reference to our protocol, in reference to employees wearing masks, it kind of depends in reference to what type of call and what type of, what we're responding to, what type of incident. I can tell you we've had to work with the state attorney's office in reference to a protocol in their building where sometimes officers are required to wear masks when they're in common areas. And obviously, if we're responding to a call where we know that it's COVID positive, we are encouraging the wearing of masks. We have provided masks and other sanitary and PPE equipment to our employees, but we don't have a blanket policy that every minute that they're working, they're going to have to wear a mask. In reference to the jail population, we are not at that point. We use dorms, cells. There's individual cells, yes, but we use dorms that we have allocated as we bring new individuals into the jail and keep them in a quarantine period. We can get very we're equipped to be able to move resources around in our 3 different correctional facilities. So we are not at a point as of yet to be worried about the space in reference to the overall housing abilities that we have in our facilities.
Sky with WJCT.
Hey, Mayor. 2 quick questions for you. One of them, according to the AHCA, and you kind of touched on this a little bit, hospital ICU beds are at around 30% availability. I know that changes a lot. There's also 37% availability just for hospital beds overall, not just the ICUs. Wanted to ask, are these numbers that you've seen an increase, a decrease in? Are they numbers that you feel comfortable with 30 to 37%? The other thing I wanted to ask you about was percent positive. It's something that you have usually led off most of your media conferences with. So I haven't heard that yet today. So I wanted to ask, what's that currently standing at?
Sure. So in my discussions with those in hospital leadership, yes, there's the hospital capacities right now are normal. In fact, I believe I stated earlier that the ICU capacity is higher than it was before the pandemic started. However, this is a fluid situation. It's a virus that's with us. Things could change in a day. Things could change in a week. So there's contingency plans in place should there need to be an expansion in beds. Right now, there is no concern or belief that will be needed. And the best way to mitigate that is for people to practice social distancing, wear masks in public. The percent of positives overall, I do have that number. It is 3.7%. So cumulative percent of positives remains below 4%. And as I said before, it's worth restating, please hear me on this. Folks trying to calculate a daily percent of positive cases it's not an accurate number. If 800 people are tested today, you won't get 800 test results back the next day. And those 800 test results won't all come from the health department in the same day. So all we can watch are trends, and that's what we're watching. We do know that there are more people testing positive. And encourage mask wearing, strongly encourage it, social distancing, stay out of crowded places where you are shoulder to shoulder with people for extended periods of time. Ben with Action News.
Good afternoon, Mr. Mayor. I want to ask you first off, this is a 3-part question. Why did you criticize me on Twitter last night when I asked you for information related to the statement you made? Number 2, you gave out 14 people are in ICUs right now in Duval County. Why can't you provide a running tally of that number for the past 2 weeks to back up your claims? And number three, a point of reference for all your briefings, or many of them have been percent positive, but it appears now you're walking that back, that now we shouldn't be focusing on percent positive each day. So can you please clarify that?
Sure. In response to your first question, I did not interact with you on social media personally. As it relates to ICU beds, as I have updates, I'm happy to provide those numbers to the public. Again, 14 in ICU across the entire city of Jacksonville right now. And as it relates to percent positives, I've not walked anything back. I have consistently reported the percent of positive of cumulative cases. If you've paid attention to these press conferences, you would know that percent of positive for cumulative, which is the only accurate number you can report. I've not reported daily positives because you cannot calculate that number accurately. As I stated, if you test 800 people today, those 800 test results will not come back necessarily tomorrow or the next day, and they won't all come back the same day, so it's not an accurate calculation. Andrew with the Times Union.
Yeah, I have a couple of questions for the undersheriff. Undersheriff, you mentioned that JSO through contact tracing targeted inmates to test, which led to the 20 positive results. So my first part of the question is, how many inmates have been tested since April? And then related to that, what are the protocols for testing sworn officers, corrections officers, contract staff, and other employees? And will they also be tested on a daily basis?
Okay. So in regards to the total number of tests, I think I already gave we're probably just over 100. Our daily count today is 2706. So obviously that number fluctuates from day to day with people being released and new inmates coming in and new arrestees coming in. So our goal would be, once we get to that point of everybody being tested, everybody will be inmate wise. Now you have to remember, they can refuse testing. You're asking them to partake in a medical procedure, and they can refuse. And at which time, if they are, because we've been doing a normal screening process with questions and temperature checks and things of that nature. If they do, that they're quarantined. In regards to our employees, it's been out there for several weeks where first responders and employees or citizens in general, if they want to do it unattached to the agency, have had the ability to be tested, many of which have been. Again, then you get into the point of sharing of test results and potential medical information. But we will also, if our employees want to be tested, they will be tested. If they refuse, and they are obviously asymptomatic, we can't force anybody to be tested. But if they are exhibiting symptoms or anything of that nature, or we temperature check them too as they come in the facility, we will send them home. They don't have that option to come to work if they're exhibiting signs. We have the ability to not allow them into the facility and work.
Last question, Jim with News for Jax.
Unmute here. I wanted to ask you a little bit, you've been talking about the trend that you are seeing the positive cases go up. Now with the RNC, and the criticism that's been coming with that as well, and now that we're seeing this trend of positive cases not as sick, do you need to think again about the RNC, and can anything be changed as a result of that? And also, can you also address with the RNC the security zone? Because there's been a lot of concern about what's going to happen downtown, and the information is not available. Like, what are the venues? We know the arena, but what about everything else? There's a lot of questions out there regarding that.
Jim, as it relates to the RNC, it's late August, so we still have quite a bit of time before we arrive to the event. And as I've said before, and I'll say again, because it's what's going to happen, whatever public health precautions and actions need to be taken at that time, given the environment we are in, will be taken. For example, we know there will be temperature checks and other protocols in place. As it relates to masks and other public health, whatever is happening in our city, we will implement protocols that are in the best interest in the health of the people that are in our city and traveling to our city. As it relates to the security zone, I've heard some people over the last week opining on that they've heard what the security zone may look like. I don't know where they're hearing it because I haven't heard it. That is a security decision made by Secret Service and the federal government to protect the president and his team. It's a public safety decision. When we have that information, we'll share it. But if any public official in the city is saying that they have that information at this time, I don't know where they're getting it because the feds haven't shared it with our office at this point in time. I don't know that that decision has been made. Clearly, we will work with businesses. The host committee will work with businesses to make sure that we're doing everything that we can so people get a piece of the economic action when the event is here. Thank you very much for tuning in today to this briefing. Again, please wear a mask when you are in populated places, dense places, particularly indoors where you can't practice social distancing. Wash, sanitize your hands. Those of you that are compromised immune systems, high risk categories, you need to be extra cautious these days in terms of being out and about and around people. If you're young or you don't have a compromised immune system and you think that that this is not a risk, this virus is not a risk, you could take it back to a neighbor or someone that you care about that has compromised immune system. So let's all behave responsibly and in the interest of each other's health. Thank you.